Hello everyone, my name is Jessica Sossaman and I'm going to be presenting on a centralized approach to managing data for UCB. So a little bit of background on UCB. It is a global pharmaceutical company focusing on neurology and immunology, and they were founded in the 1920s and currently have surpassed over 4.9 billion euros in total revenue. And UCB places a strong emphasis on innovation to effectively drive their mission, and they often say there's no such thing as an average patient. Currently, 26% of revenues are allocated to research and development. And through their corporate societal responsibility, they actively support patient groups who provide valuable services to patient communities and understand what it matters to the people living with severe diseases. For a little bit of background regarding the pharmaceutical industry, it does take an average of 10 or more years for the creation of a new drug from the discovery to marketplace phase. And the average cost for research and development for each successful new drug is a staggering $2.6 billion. And only 12% of all drugs that enter clinical testing are successful. Currently, the concept of personalized medicine is something that is at the forefront of pharmaceutical advancements, and this truly is because all of the data that is available is really allowing scientists to hone in specifically on the causes of diseases and ways that they're able to treat patients on an individual level. In a study done in 2015, they found that about 42% of all medications that are currently in pipeline for development do have the capabilities to be these personalized therapies. And so as we know, drug discovery can take immense amount of time and resources, which really does contribute to the expense of many drugs and even their inability to make it to the marketplace in itself. So drugs used to fight ALS, for example, aren't being developed despite the 140,000 new cases of ALS being diagnosed each year worldwide. And this truly is because the cost of developing drugs far outweighs the demand, which means that such investment would not pay off for these pharmaceutical companies. And so here we have a graphic by UCB that shows the drug development process and the lengths that go into the creation of one drug, all the way from year 1 from the exploratory research all the way to year 13 for the phase 4 trials. And truly a lot of research even goes in before year 1 as well. A centralized approach to managing data is incredibly pertinent for a pharmaceutical company for a variety of reasons. So just to refresh, a centralized system really allows all resources, tools, and methods to be managed and deployed by a central group within the organization. So this does allow for a lot of different benefits that are especially pertinent to the pharmaceutical industry. So they can prioritize the enterprise view. So this really drives an optimized organizational data science strategy, as where requests are prioritized based on the needs of the organization. So specifically in the pharmaceutical industry, where you only have a few core projects at a time, this is really important to ensure that you are driving exactly what your organization is going to need for the next decades, since your current projects are going to really depend on the longevity of your organization. And it also will make it easier to accomplish large, complex projects. So analysts have the ability to share knowledge and collaborate within their departments, whereas in a decentralized model, kind of what is learned stays there. Talent management is also incredibly important. So there will be a clear promotional opportunity for those dedicated data scientists, as well as on-the-job training and advancement for junior scientists. Having an ability to grow skill sets across various domains is incredibly important. And the addition that not everyone will need to then function as a generalist, since you do have that large data department rather than just spread out across the entire organization. And lastly, it does ensure standardization and enterprise oversight. So really that ability to leverage best practices to build and scale, as well as the facilitation and adoption of the discovery of new common tools and framework, which will help keep the organization efficient. So in this industry, a centralized approach is incredibly important just due to the unique circumstances of the pharmaceutical industry, and that it really needs to leverage that centralized hub of data to ensure that it's able to holistically look at its organization and ensure that it's making the best decisions, since it does have to plan for decades in advance, as well as the cost associated with those drug developments. So critical decision making is incredibly important. So not only is data used to help decrease drug discovery and manufacturing costs, but it can also be used to help government health agencies, payers, and providers make important decisions related to drug discovery, such as deciding which drugs should be developed, because we do have orphan drug laws which do help grow drugs for diseases that don't have as much attention to. So as we know, like diabetes and hypertension are very common, so they're very profitable, whereas other drugs not so much. And so we really need to ensure that we use that data to figure out what drugs need to be created that haven't already been looked at or given more attention due to the cost and the time of innovation. And additionally, the structure of pharmaceutical companies, such as UCB, they only can focus on a few core projects at a time. So when you look at the UCB website, you see that really throughout their entire duration of their company since the 1920s, they only have about a dozen or so core drugs that they have developed, but they are so profitable for the organization, and they do have to reinvest so much of those profits then into the R&D. So in a world where data is so new and evolving, having a centralized approach to data management does allow for deeper control, allowing for the proper allocation of those few core projects that will really secure the finances of that organization for decades. And then the drug development process is consistent across the entire organization, kind of as we saw in that chart. So that just allows the entire organization to leverage the data and further improve as a whole rather than just departmental. So that decentralized system is really going to kind of segment off the different innovations that the entire organization could benefit from, since it is pretty consistent across the board. And lastly, industry-specific needs. So kind of as we talked a little bit about, just because the pharmaceutical industry, as far as the research and development, is so different than other industries, we really need to ensure that having that centralized hub really allows those top executives to really see overarching what is happening and being able to project out to the future. So thank you for listening to the presentation. I look forward to continuing to discuss this with you all. Thank you.